Ooh.
Filler. Okay, we're live.
We are.
We are live. I guess so. Jules, can you check if we're live? I think we are. Okay. Welcome to the Artisan Hour. So you know how lately we've been doing weekly lives where we go in for an hour and we just talk about anything related to beauty, wellness, skin, injectables, laser, all the things under the sun. And so today we actually have
Hi. It's my first time.
Yeah, it's his first time. He's not very excited about it, as you can tell. But anyway, we have him today because we are going to be talking about all things filler, right, Jonathan?
Right. Yes.
So we'll be doing a Q&A, actually just between ourselves, most commonly asked questions, and then we could answer any questions that you might have, and then we can talk about, filler. So, okay, yay, fillers.
Right,
so we'll actually keep it very casual, guys, just because we've had some challenges having to put this on live and then have my own personal account, so we just thought we'll just do it. We'll just wing this thing. Okay, what questions do you have for me? And obviously we'll go back and forth.
Sure. So I've listed down some questions.
Okay.
So first one, very basic.
Okay.
What is dermal filler?
What's dermal filler? Do you want to actually
sure.
the sound? So what is it made of? Basically, and Jules, actually, there's one question there. What is it made of? So fillers are actually made out of hyaluronic acid. Back in the day, fillers were made of different properties. So some, if you've heard before, we've had like silicone implants, bovine implants. It was only, I think, around in the 1990s or the year 2000s where hyaluronic acid fillers were created. And how they now are the gold standard of fillers is because they are very much similar to what we all have, which is hyaluronic acid. So if you know, everyone has their hyaluronic acid serum at home. They're basically just created differently so then it stays in the body for long periods of time. Essentially, it's a gel form. And so that's why it really just integrates to the skin so naturally. And that's why the body actually takes it so well, because it's something that's innately natural to us. And so there's nothing really scary about filler.
True.
Right?
Yeah, you don't get allergies to it.
Because
it's HA, it's already sitting in your body. And that's right. It's made in a way that it can last a certain period of time, depending on the type of filler you're using.
Depending on the type, depending on the formulation, and depending on the area that you're injecting it. Right.
Yes. All right, next question. Good answer for that.
Thank you.
Who is a good candidate?
Who is a good candidate?
This is very critical. Yeah.
I know.
Patient selection is very important. Yeah.
When the clients come in and they ask about if they're a good candidate for filler, there really isn't a certain time or age where you should be doing filler. Obviously, we don't treat anybody that's 18 years or younger. But anyone who has experienced volume loss, and that can be in all areas in the face. It's very typical that when you hear about the word filler, it's always the lips that comes to mind, because it's one of the areas that are very most popularly treated with filler because of the volume loss. And that comes with just age and, time, and, you just see some sort of deflation in volume loss. And so I wouldn't consider there's someone, in terms of being a good candidate. If you see some volume loss, then you are a good candidate, unless obviously if there's any contraindications that you can't be. You're not allowed to be doing filler, right? Areas where it can be done?
Lips.
Yeah.
Temples. As we kind of work our way up to bottom, then temples, cheeks, like mid-face would be like lateral mid-cheek, nasolabial folds, marionette lines, jawline for sure, periauricular area. Actually, it's anywhere on the face that fillers can be injected and can add support and volume, right? So yeah. Neck is also an area where we can do.
Well, I just did that. I just did my necklace lines.
Skin boosters, your neck lines, yeah.
I still have some bruising there, but yeah, it's a lot
How
of
about
areas.
a client that is not allergic to the filler but allergic to hyaluronidase?
True.
What's your take on that? Like, do you treat them? Because in case of, knock on wood, if there's any adverse effect or any vascular occlusion, well, what's kind of like, is this client still
a good
A
candidate?
good candidate, or would you do something else?
That's a good question, because the dissolver hyaluronidase basically is a compound or an acid that breaks down filler. Has been shown, if you have allergies to bees, if you get a bee sting, if you develop an allergy from that, you could be allergic to the dissolver, and so which means you might not be a good candidate for filler, because should there be any complications like a vascular compromise or vascular occlusion, then you wouldn't be you would have an allergy to it. So it's almost saying if you're allergic to the dissolver, then you shouldn't be doing filler in the first place. I mean, it's pretty trivial. In the past, we've said no to clients who are allergic to the dissolver, of course. But sometimes case-to-case basis, if they are actually respond to like an antihistamine, and then we can kind of see how they respond to that. Again, it really comes down to the comfortability of the provider, but essentially at Artisan, when we do like a skin test for a hyaluronidase and clients are allergic to it, then for the most part, we don't actually treat them with filler, just for safety. We could definitely give them other options like PRP, natural gel, all the other more natural options. But if it was filler, then most likely not.
That's true.
Yeah.
There's other options around. Like
There's a question here. Is it true that
Yes.
filler stays in the body forever?
Oh,
Is it paused?
no, it's
No.
alive though.
It's alive. Okay. So product monograph in the filler, in the boxes of the filler, the companies will actually tell you fillers last 9 to 12 months, 6 to 12 months, depends on the area, depends on the formulation. But there's been some clinical studies that have shown that after many, many years, like fillers in general, there has been MRI studies where it stayed in the body for like 30 years. So we are in a position to not say that, oh, you have to do fillers every year, you have to do this every 6 months, because essentially they don't get metabolized by the body faster or more than we actually think, because I think they don't. Not to say that there's anything wrong with it, but they just stay for longer periods of time. And if clients can actually get away with doing lip fillers once a year, once every 2 years. We've had clients who we haven't touched their lips for 3 years, although we see them more regularly for other things in other areas. It keeps their results natural, and I don't think that's a bad thing.
Yeah.
Yeah.
Also other factors, right? Like if you're someone very active, like you're an athlete or what, so it can also affect like absorption, right? Like people that we have treated that are very active with their daily routine,
Their
with
lifestyle.
things doesn't follow on the average of how this product can, affect them, right? Like it can last just for 6 months instead of like a 1 year kind of like timeline. So there are factors, but on the average, like, fillers can stay like, a certain period, and yes, that's what Gina mentioned. MRI have shown like after 30 years it's still
can
there.
still stay.
But minimal amount though. It's not like the full amount that was
no.
delivered during the treatment. It's just residual fillers.
But who doesn't want extra volume, right?
True.
We all
Yeah.
want that.
All right.
What else do you have there?
Third question. There's a bunch, but we'll
Okay,
see how much we can reach to this. Why is injector skill and experience / training matter?
Why does it matter?
Yes.
Why does it matter?
Like for me, like skills wise, like it matters in a way that you know what you're doing in the first place, right? You know how you have the eye to assess the area, like what's the needs. Like for sure the client would tell you like, what's the concern, what's my my stress point or my pain points that I want to address, and then it's your job now to kind of like provide a plan for her, right, or for him. So skill wise, training experience is very important in order to deliver the result, right? Like if you're just not equipped enough, you don't have much in your toolbox, then you won't be able to deliver like the full potential that you can give for this client's concern.
Let me add to that too, because I think anybody can pick up a syringe. Like anybody can, you can hand someone a syringe and inject, but not everyone can do it in a way that still maintains the naturality of your anatomy and that you look the same, although just fresher and a better version, right? So I can imagine back then when I started just doing injections, and I was obviously like a very novice baby injector. I was taught a certain way and to do it a certain, like, step 1, 2, 3. And then you end up realizing you can't actually do that approach on every single one, because everyone's facial shape, everyone's racial background is super different, and the anatomy is different. So now everyone's looking almost the same with high cheekbones and chin and lips, but you have to cater according to the patient, and that's why, you know, a very customized, custom tailored approach in creating a treatment plan is super important. And then that's where experience comes in, and training too. Aesthetic medicine is a very, very young industry. It's only been around for about 20 years. And so there's I would say we think that we know so much, but we actually don't. There's so much that we need to know. And the moment we stop learning and knowing and innovating and just, you know, trying to really get into the nitty gritty of all the things, then you really cap the potential of the outcomes that you can get when you know more. And so, you know, in our industry, that's why, you know, being so updated with the latest trends, and not even just the trends, but the techniques that we used to know back then 5 years ago may not be effective at this point already, because now more clinical studies have shown if you do it this way, then the one that we used to know before, they actually work better and it gives us natural results. So, I mean, essentially the whole bigger picture is that scale definitely plays a big part into giving you the natural outcomes, where these procedures are not cookie cutter approaches, and these procedures have to be done in a very sophisticated way to give you a natural result, and at the same time one that, you know, also just accentuates your natural own beauty.
Yeah.
Right?
Not only that too, like on the other side of it, like we always want to have safer injections, right? Like there's no safe injection, it's only safer injections by knowing, you know, the anatomy of the face, not the face, the neck, or any area that you're going to treat, right? So with that, like it requires training, it requires advancing your skill, right? Like there's so many venues now, you know, to mention like Codafana is really big on anatomy, and yeah, I've been into like 2 or 3 events with him about, like, you know, knowing more about the anatomy, any updates of what they found out about, you know, the face, the layers, like, you know, where this veins and arteries sits. So yeah, like, you know, we always aim that, you know, we're not, you know, there's always a chance of that adverse reaction complication because it's injectable, right? Like we don't see the skin as glass. There's always those layers, those veins, there's changes in the anatomy, not like averagely sitting on one area. It can be like, you know, different in one person. So being able to, you know, do safer injection is very key and important. And also, like, you know, for your practice, right, you want to deliver results and not like have issues on those kind of situation. Yeah.
Perfect.
Yeah.
Very well said.
Perfect.
Okay, let's move on.
Okay.
We don't have much time.
Sure. How to select the right filler for the area?
So for every company, fillers definitely, you have like a wide range of portfolio. You can choose between soft, medium, thick, or stiff. So we definitely choose them based upon the results that we're looking for, and also not just that, but also how it can integrate well with a client. So a filler that's soft will sit well on me, but if I put it on Jonathan, because he has thicker skin, it won't show. So we choose it based upon the outcome that we want and the patient that the injectable is going to go to.
So again, patient selection,
Yeah.
right? Like, you know,
Yeah.
patient selection and what's the area of concern. That
Yeah.
would be kind of the important points to address before doing any treatment.
Downtime with
yes.
filler. Obviously, you know, you will be numb before the treatment, but after you're expecting some redness, some bruising, some swelling. Case in point,
Yep.
bruising.
Yep.
I did his filler 2 days ago.
2 days ago, yeah.
Swelling. I'm still a little swollen because I did my filler 2 days ago too. So that's part of the process. But ways to mitigate them, to avoid them if you can, is to avoid any Advil, alcohol, aspirin, any products that will thin out your blood at least 48 to 72 hours before, as approved by your doctor with aspirin. What else? Some people would take Artica pills, Artica cream prior to the treatment. Pineapple It's been shown to have bromelains. It has like anti-bruising properties, anti-inflammatory properties. So some people would like munch on pineapple. But otherwise, after the treatment, putting on ice pack, just allowing time is super important. So planning ahead is essential because it takes about 2 weeks for everything to fully settle. So, bruising, swelling, all of that, it's all a process. You have to trust the journey. And by 2 weeks, everything will integrate and everything will settle well right around that time. So you need to plan ahead.
Correct. Yeah, planning is very important. Like, because there's always going to be downtime because we're poking the skin, we're breaking the skin.
Yeah.
There's going to be inflammation, chances of bruising will always be there. Yeah. All right.
Can it be dissolved? Maybe
Correct.
let's do like 3 more questions
Sure.
and then can it be dissolved?
Yep.
Yeah.
Yeah.
How?
Yep. We just mentioned hyaluronidase
Yeah.
earlier, right? Like, if there's any person that is allergic to it. Yeah, so that's the dissolver. That's also our emergency drug if there's any adverse reaction. So what it does, it liquefies or melts the filler into a more softer, more liquid kind of like consistency. In that way, then usually it's like occlusion. It's very big, right? So partial or full occlusion. So we want to liquefy that gel so that blood flow will return its normal kind of flow.
And I think that's one of the biggest things that we don't.
Yeah.
I mean, at the end of the day, fillers are still a medical procedure and they have to be treated as such. And so every medical procedure has medical complications that can happen. And one piece of that is when you talk about the possibility of a vascular occlusion. Really what it is, it's essentially the product went into a vessel or an artery that supplies the area. So what we wanted to do is we wanted to recognize it early on. That way we could reverse the occlusion. I mean, again, a good injector definitely has to have all the protocols in place to make sure that it's something that easily we could reverse. And ultimately we have a network that we could refer people to, hyperbaric chamber, ultrasound, all the other things, just to make sure that your treatments remain safe. And are done in the best, safest environment, right?
That's absolutely correct.
Yeah, I think 2 more questions. The one thing that I wanted to address too is the talk of filler. It's always been like, oh, I don't want filler. Like you always hear it because it makes one look unnatural. What would you think? Why do people get unnatural results when they do filler?
So what I would say, like based on my practice, is one, that area is not like properly assessed, right? So for example, under eye, like you don't want to use something like really middle thickness or something that you use for the lips. That area is like very thin. So if you use that product, then for sure you're going to end up puffy. So people or clients would hate you for that. So product selection is important. But first, yeah, if that area is really a good area to inject fillers, because again, there's other options available, right? Another thing is overfilling the area. So with fillers, the nice thing about fillers is you can build it, right? Like you can start with 1 syringe to begin with, and then see the results. And if there's room for more of that product, then you can do so. But if you're overly filling one area at one session, then that creates those overfilled areas or overly done look. And lastly for me is, as an injector, as a provider, we do have the opportunity to educate our clients, right? So some people, they would say like, okay, I want to follow this certain individual because of
show you a photo of a model.
A model, like I like this look, right?
Right.
But every individual has different anatomy. Like some can be achievable, some it's just not possible, right? Because of your baseline. So those things like proper education, proper planning for the goal, like you're gonna be on the same page all the time, right? Like if his goal is not the same as yours, then for sure there's gonna be a disconnect with what's gonna be the result of the treatment, right? So those are just conversations, especially like you always start with consultation and then take it from there, like a good facial plan, and then just going to the step of creating that journey for her and the experience too, right? So yeah.
So I think that's the thing, right? Overall, as an industry, it's unfortunate how it came to a point where fillers are viewed negatively because of the outcomes that we see. Like we still see a lot of bad filler jobs, but mind you, if they are done well and in such a sophisticated manner and fashion, a lot of people may actually, you walk into someone, their face has probably had a lot of filler, but you just didn't know because it was done so well. So back then in the day, I think the whole like Beverly Hills Desperate Housewives look was people looking like all crazy and all overdone. But that's 20 years ago. Like our techniques are different back then, and how we approach facial aging is very different than how we do them now. So back then, when we see a fold, we just go ahead and fill it completely, and we end up with so much volume in the mid face. People looking so natural when they smile. But then now we understand that these folds actually is a cause of all that facial fat pad descending, and so approaching it and having the tool in your toolbox to actually use the other modalities to create that lift and restore that volume without overfilling the face is there. And so, doing structural skin tightening, ZERF around here, doing Botox on some areas, doing laser. So really a good combination of all of the modalities that you have in clinic, and not just filler, is going to give you those natural outcomes. But the thing is, there's no other product that can fill than filler. And so filler definitely has a place, but it shouldn't be your only tool, So I remember when we first started, we were like, okay, let's do injectables, and we're just going to hone in on injectables. And then we're like, we can't really get to the results that we want because we're maxed out, and we can't just continue to fill and fill and fill, because it can't really lift, right? We need other tools. And so that's why we have ZERF to tighten, to lift, and then have other things to also put volume in, right? Mid cheek, you can't really put in, just whatever hydrofacial and expect it to lift. Like nothing can replace filler. And so again, done in a way that respects your anatomy with the injector, that knows the area where to treat, and do it conservatively but subtly, that respects your anatomy and your natural look is the key, right? You can't overfill. And mind you, the hardest part of our job is to say no, and we've said so many no's where we could have just easily said yes because it's business, but it's building your reputation too, and saying no when you can't, because then it's not going to look natural, it doesn't look good, and it doesn't reflect the brand and the natural outcomes that we want clients to see, right? So filler is here to stay. Our technique is always a place. How we approach fillers now is super different. Our techniques are so much better. Our products are made so much better. And so that's why you get to have so many beautiful outcomes with filler. But again, it should be a combination of all the other things, right?
That's
Agree?
very true.
Agree? Okay.
100%.
I love doing filler. I love doing full facial balancing. I love doing multiple syringes, but in all areas in the face to balance. I love doing a little bit of temple, a little bit of mid-cheek, a little bit on the lips, chin, jawline. Again, it's when people do one area at a time and expect this result to be natural. It actually isn't. It only amplifies the other, and it doesn't keep the face balanced if you just hone in on one. So doing everything actually will give you better results. With that in saying, if we have a promo. With that in saying, our injectable sales event is happening. When is the 9th? On Saturday.
Saturday, yes.
From the 9th to the 18th. Keep your eyes peeled, because we are doing our injectable sales event, which we run here and there, but you will see the best, the best pricing for injectables, for neuromodulators and for fillers, because we want you to take advantage of it. And we want you to see these results and these outcomes, because again, there's nothing that can replace filler, unfortunately. Even if we keep on looking at other alternatives, again, filler definitely. When Jonathan did my filler 2 days ago, and then I said, and he did it one area, and I said, well, this is the reason why I haven't done filler actually in a while, because I've had 3 kids, pregnancy, breastfeeding, all the things, and so when I saw it, I said, there's a reason why people get so obsessed with filler, because they look so good right after. But again, it's our job to say, no, you can't have any more filler. Now you need to do something else, because it isn't really the only thing, right? But when we say 2 syringes, 4 syringes, it doesn't really matter, because it's not really a lot of product.
No.
When we say how much is 1 syringe?
Like it's a quarter of a teaspoon.
Quarter of a
So if you
teaspoon,
can
that's so
imagine that
little.
on your head, like it's a very little amount of product.
Yeah, it's very little. So
Yeah, and
So-
it's like how we calculate, like, you know, how much you need is like every decade of life is 2 syringes
to
right?
get you back the
That's
volume that
average,
you've
right?
lost.
Like,
So if I'm 20,
mhm.
let's pretend I'm 20.
How I wish.
So then what do I need? I'm closer, let's say mid 30s.
Yeah.
Then I would have needed 3
Yeah,
syringes,
3
to 4.
average. Yeah.
And I've had a good 4 syringes, I would say, over the course of like maybe 5 years. And so the goal is not to look 20 years younger. The goal is to remain the same age and keep in that age for the longest time possible.
we can't stop aging.
We can't stop aging. We want to embrace
there's
aging. It's a
no
privilege, right? I
way to
always
do
say,
that, but
yeah,
we
it's a
can delay the
privilege to
process.
age. But and again, it's not a need. It's there for people who want it. And if people decide and they just want it to age naturally without not medically aging, then that's totally fine too. Just you do you.
Yeah, it's really your call, right?
Yeah.
To yourself. Right?
Okay, let's wrap up because then it's 12:34.
I know.
We hope you had a wonderful time joining us today for the Artisan Hour. And I believe next week we will be talking about Botox because that's super common. And
Am I in again? Or?
no, you're not. You're not because he said
Not
he
good
doesn't
at
like
this. Like,
if
but
you.
it's a nice
No,
first
but
time.
you actually were
though,
super
right?
natural. You're actually good. You're actually good. So maybe we should do
No
this again
script,
sometime.
nothing, just questions.
Yeah, but maybe we should do this again sometime.
Yeah. Maybe the next 6 months. Yeah.
Or a year.
I have more to do.
Anyway, thank
Just
you
kidding.
guys for joining. And keep your eyes peeled. August 9th to 18th.
Yeah.
Injectable sales event.
Take advantage of it. It's
Don't
a really
miss
good
it.
pricing for those
Don't miss it.
treatments.
Okay, bye.
All right, bye.
Bye bye.